Hello, class. My name is Enrique Lopez, and for the diseases, risk factors, and health project, I decided to do mine on obesity. In this presentation, I will be going over signs, symptoms, and risk factors, effects obesity has on a healthy body structure and its functions, tools and diagnostic tests used to treat and diagnose obesity, practices to prevent obesity, and the characteristics of those infected with obesity. Some signs, symptoms, and risk factors are consuming a high amount of calories, but not burning the consumed calories. So you say you are eating a large amount of food, but you are not doing anything to burn those calories that are consumed. So they're just sitting there and kind of building up a lot of kind of fat concentration in your body, which can lead to a lot of high blood sugar, cholesterol problems, etc., which in turn leads to becoming overweight. Um, consuming highs consuming high amounts of foods that are high in fat concentration. So that's a lot of fast foods in America, a lot of greasy foods especially. And again, that would kind of feed into the cholesterol issue, etc., etc. Eating too many sugary foods, this one especially I've noticed to become a prevalent problem in America, especially because of how much sugar is in our day-to-day food, especially in fast food, which a lot of Americans tend to look towards for a meal because it's cheap and fast, etc. So that can lead to, again, becoming overweight. Lack of physical activity. So this one kind of coincides and goes hand in hand with the first three risk factors. Because say you are eating all of these things, but that's a lot of calories, but you're not doing anything like physical activity to burn those calories, which then you will kind of just all those calories will build up a lot of cholesterol, a lot of blood sugar levels, in turn would lead to overweight, which would eventually lead to obesity. There's some characteristics of obese patients that we've noticed. So according to the CDC, obesity was a common occurrence of 39.8% among adults from 20 to 39 years old, with the highest percentage being among 40 to 59 years old. And it kind of makes sense because as you grow older, your body starts to slow down and you are not able to kind of do the same physical activity you are able to once you were younger. According to the National Library of Medicine, the largest racial and ethnic group to develop obesity is Black women, with the percentage of obese Americans being 56.9% being Black women. Some effects obesity has on the healthy body structure and its functions. So obesity can cause mental anguish such as low self-esteem, which can lead to mental issues such as anxiety, depression, etc. Obesity can cause victims to become out of breath easily because you are moving a large mass because you weigh a lot more, and with you moving it drains a lot more energy. And this also was in with the next one. Using a lot of energy will cause your heart rate to increase by especially when you're doing small tasks that an average person would not have an issue with, such as walking or even breathing at sometimes. And then obesity can cause joint pain because of the strain that is put on the bones and joints from the extreme amount of mass that you are carrying around. Some other issues are increase in sweating, difficulty doing exercise, and feeling tired and drained easily. This kind of goes hand in hand with these ones because with the ones I spoke about previously, because of the large amount of mass that you are moving, it kind of takes a lot out of you. You are just a human, you know, your body is a machine and it gets tired, especially when overworked. Some tools and diagnostic tests used to treat and diagnose obesity. So it is one of them is a BMI, which is a body mass index. They will take your body fat percentage and kind of see if you're in the scope of obesity. A waist circumference measurement, physical exams, health history, family history, and lab tests are just some other ways that you can diagnose obesity. Some practices to prevent obesity. So especially this, so switching to a healthier eating habits. So kind of eating things that aren't so high in sugar or calories, and especially you are make sure you are getting a lot of the necessary nutrients in order to kind of have that energy to work out. And this one goes hand in hand with the first one, increase in physical activity. So by eating healthier, you are getting all those vitamins and nutrients that make you kind of, wake up in the morning and say, okay, I'm ready to take on the day. And then that it will definitely increase your mentality, which will kind of make it easier for someone to like to partake in physical activity and kind of help them help them lose a lot of calories that are kind of just sitting there. Behavioral therapy. So this one, so a big part of becoming obese is the mentality. A lot of people that are depressed, especially that have these massive depressive episodes, find themselves not caring of what they put in their body or not even wanting to get out of bed, which can lead to, you're eating all these things, but you're not doing anything to burn those calories. So if you go to behavioral therapy, they can kind of help you discuss your problems. Meal replacements and low energy diet. So a lot of these are kind of like ketos, vegetarian, um, vegan, even in some other cases. And then of course this is a bariatric surgery. And these are my references right here. Okay, thank you for listening to my presentation, and that is all for me. Thank you.